Hi, I'm Dr. Ladipova, and I wanted to share with you regarding a new treatment that we're offering in our office for patients with orifacial pain, with headache, frontline TMJ issues, and parafunction. As we all know, stress is the source for all the problems and diseases in human body, and we as humans very often harbor stress in our head and neck area. And you can even quantitatively check the stress presence with cortisone levels in saliva. And majority of people have this pathway of stress expression. Over 90% of people do grind and clench their teeth at night, but these episodes are really short and they can be multiple a night. It could be just a few seconds and hundreds of episodes of grinding and clenching. The effect of grinding and clenching on your face, neck, and muscles is tremendous. And this is the major reason for fracture of the teeth. And I can attest that majority of the teeth I extract in our practice are related to the parafunction. And 18 months ago, I got trained with American Academy of Facial Aesthetics in regards to Botox treatment for TMJ and orifacial pain issues. They could be limited applications into the masseter muscles or the full treatment of trigger points that address most of the muscles of mastication. And I wanted to also address the general superstition about Botox. It doesn't remove wrinkles in this case, and it only acts for about 3 months, which is a window of opportunity if you talk about making new pathways. Since the parafunctional habits are unconscious, conscious willing is powerless in removing these habits. So when people say, I'll try to relax, it doesn't work 100% of the times. But Botox addresses the hyper-functioning muscles that are engaged in the vicious cycle. And if you have a 90-day window excuse from the habit that's been running for years, there is a chance for healing. The amount of Botox injected is very minimal, and I try to even find the dose that is appropriate to the patient, starting with the smallest possible, and then maybe adding a couple more units if need to be. But the effect is that the function is completely untouched. It's only the parafunction that is affected, so this little overstress of the muscle is removed. And when there is no strain in the muscle, then healing is possible. And I have some of this information on our website, and I talk about this with the patients when they come for their recall visits. And I really encourage everybody to think about this treatment that is very minor and relatively inexpensive, although not covered by insurance, that can affect their habits that harm their body and health in a big way. Thank you for listening.